Cumberland County Commissioners will now please come to order. Will everyone please stand as we honor God and country, and I'll call on Commissioner Lancaster to bring forth.
Thank you. Good morning.
Good morning.
Please pray with me. Heavenly Father, may our lives be filled with thanksgiving. In addition to thanksgiving, Father, may we receive praise, and may we give you praise for your countless blessings. Father, please give us assurance that you will supply our needs. May grace, mercy, and peace be with all of us as we approach the holiday season. Amen.
Amen.
Pledge of allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Lancaster. I'm going to move down front now for a couple of recognitions. Can I have Officer Deputy J. Murray, please, and his immediate superior? I'll just stand over one side, you guys can see it. On the evening of February 26, 2020 at 4:46 p.m., the Cumberland County Sheriff's Office was dispatched to Hope Mills Middle School on Cameron Road after being notified of a shooting in the roadway of the school. The first deputy on the scene gave Deputy to J. Murray the necessary information needed to track the suspect's vehicle. Within minutes, Deputy Murray located the vehicle on Rockfish Road that matched the description given Deputy Murray, and then made the crucial decision to follow the suspect's vehicle to a residence on Clovis Court. Deputy Murray's wise judgment assisted in the arrest of the shooting suspect and several others for an assortment of felonies, including discharging a firearm into an occupied vehicle, various drug offenses, and carrying a concealed weapon, illegally, I'm sure. Upon a search of the vehicle, officers discovered four firearms and narcotics. We want to recognize Deputy Murray for receiving the Award of Merit and thank her for her service to the citizens of Cumberland County. And at this time, we county commissioners salute you and the fine work that you did, and the microphone is yours if you've got anything that you would like to tell your audience.
No. Thank you all.
My kind of speech.
And you don't have anything either? Sorry. Okay, here we go.
I'd just like to say on behalf of the Cumberland County Sheriff's Office, thank you so much for honoring Deputy Murray and the rest of the recipients that are going to receive awards today. His display on that day was just one day of many of the hard-working deputies of the Cumberland County Sheriff's Office. Every day we go out to try and protect the citizens of Cumberland County. This is just one act of many, and we're so very proud of him. Thank you very much.
Normally we shake hands with commissioners, but the CDC said we don't do that anymore. Okay, at this time, we'll keep celebrating. And can I ask Sheriff's Office Corporal Christopher Blevins and Deputy Philip Russ and their immediate supervisors if they're here. Well, that might be too many. We'll get them up in a minute. Good morning, guys. On Friday, September 6, 2019, at approximately 6 p.m., Corporal Christopher Blevins and Deputy Philip Russ were on their way home from an operation briefing held at the Sheriff's Annex. The two turned onto Old Wilmington Road from Eastern Boulevard to find a rollback wrecker stopped in the middle of the street. As the driver opened the door, he collapsed on the roadway. Corporal Blevins and Deputy Rust stopped and began calling out to the victim, who was lying on his back. The driver was unresponsive with fixed pupils. Deputy Rust enacted life-saving measures as Corporal Blevins called into dispatch to request immediate medical assistance. The victim was also suffering from a large laceration on the back of his head. Deputy Rust and Corporal Blevins worked as one as they performed critical life-saving measures until the Fayetteville Fire Department and EMS arrived on the scene. Sadly, the gentleman died that evening from a medical condition. Later, Deputy Russ and Corporal Blevins were able to comfort his widow when she requested to meet the two men who worked tirelessly to save her husband's life. The Cumberland County Commissioners want to thank these two law enforcement professionals for their service to our community and recognize them for receiving this honor. Any words, guys? Thank you, gentlemen, and all three of these fine officers demonstrate what they do every day, putting their lives on the line and working on behalf of the citizens of Cumberland County. We salute and thank you so very much. Now we'll have our approval of the agenda. Ms. Cannon, anything?
Good morning, Mr. Chairman and Commissioners. We have no changes this morning.
Okay, do I hear a motion?
Motion.
Second. Moved and seconded to approve the agenda. Any discussion? All in favor?
Unanimous.
Okay, next item, Ms. Cannon.
Yes, sir. Mr. Chairman, we have a presentation this morning by a Public Health Department on tobacco control updates, and I'm going to ask Dr. Jennifer Green to come forward this morning and provide some introductions. Thank
Okay.
you.
Welcome again, Dr. Green.
She doesn't get a rest. We don't even talk about COVID, she's got to be here.
Good morning, Commissioners. Thank you for having us this morning. We have Travis Greer to present to you this morning. He is our regional tobacco coordinator and serves the region, but wanted this morning to be able to provide you some updates about what's been going on with tobacco around the country and in our region and in our county. We know we are usually up here talking about COVID, so this is a nice non-COVID update for you this morning. And in addition, I wanted to introduce our Deputy Health Director, Ashley Curtis. She has been in her role since June. Ashley previously served in Travis's position as our regional tobacco coordinator, and then moved into our local public health administrator position, and then in June became our deputy health director. So she's progressed upwards, and so I don't think that you've had an opportunity to meet her since she took on her role. So thank you, Ashley, for being here. And with that, I will turn the mic over to Travis.
Welcome, Travis.
Good morning.
Good morning.
Good morning. So as mentioned, I'm here today I will work in a little bit of COVID in there because it is relevant to where we are today. And I do have put together some slides there as for our visual aid, as you see. And today I'm here to talk about PPE, not necessarily our wonderful face mask that we have been donning for the past several months, but about a pandemic colliding with a persistent epidemic. And here in our nation, and even in North Carolina, we have been dealing with a persistent epidemic known as smoking and tobacco use. Okay, and there has been a significant ripple effect of health and financial impacts that are felt well beyond the first puff or chew of a tobacco product. Our former U.S. Surgeon General, Everett Koop, once said that cigarette smoking is the single most avoidable cause of death in our society and the most important public health issue of our time. And even though cigarette smoking is at its all-time low, as we have been hearing the terminology, the curve has been rising or flattening. Public health and the work of many policies and programmatic things, the curve has been going down tremendously over the past several decades. So still today in our society, cigarette smoking is still causing about 1 in every 5 deaths, and it costs a lot of money. $3.8 billion per year is related to healthcare, smoking-related costs as far as healthcare, and it's also associated with lost productivity time as far as how that relates to work and so forth. So as mentioned, I hope you appreciate some of the visual information, presentation here as it helps me aid and translate my points. The curve is going down. As you see, back in the 50s, man, cigarette smoking was up there. As you see today, the North Carolina smoking rate sits around 17.4%. But Cumberland County sits just above the North Carolina average right at 18%. So similarly, the Youth Tobacco Survey in North Carolina, just recently done in 2019, is showing that, cigarette smoking is still at its all-time low, 5.7%, excuse me, let me lick these lips, are using cigarettes, okay? So that's a good thing. We've made great strides, and policies and programs have been the claim to that. So, however, there's a bad news, and there's an alarming trend going on through our nation that you may have heard of, and in North Carolina, the overall youth tobacco rate is going up, okay? And some of you have been tied to education over different periods of time. So 27.3% of high school students in North Carolina still use some form of tobacco product. So I want you to visualize getting on I-95 about one of these exits, and imagine school buses lined up back to back all the way to south of the border of the South Carolina line. So 5,574 school buses full of high school students. That's about how many students are using tobacco products these days. That's still not acceptable. And the primary reason why youth tobacco use is rising, it is because of electronic cigarettes and the emerging tobacco products, as you see here. So here's an evolution, as you see, of vape products. They're electronically driven, and they have liquid nicotine or vape juice in there. And you see the evolution as they transform. They sort of look like cigarettes, and they're changing shapes and so forth. So e-cigarette use is now the most commonly used product among our youth. According to the 2020 National Youth Tobacco Survey, 3.6 million youth across the United States use vape products. What does North Carolina look like? 20.9% of high school students use vape products. Here are a couple more visuals of emerging tobacco products. On the left, you see IQOS. It's put out by Philip Morris. It is a heated tobacco product. It's not an electronic nicotine delivery system or a vape, but it's a cigarette, as you see on the mouthpiece, plugged into a device that heats the product, okay? So Philip Morris did receive marketing authorization from the FDA to put this and sell this on the market. It heats tobacco, it doesn't burn it, but they can claim that it does significantly reduce the production of harmful chemicals found in cigarettes. So they have the authorization to sell that. However, they cannot claim that and mislead consumers into believing that this product is endorsed by the FDA or that it is deemed to be safe for use by consumers. No level of tobacco use is safe for consumption. So as mentioned, a pandemic does collide with COVID-19. Overall smoking has been known to decrease the immune system and the response to respiratory illnesses like COVID-19, like the flu, and so forth. So COVID-19, why is this so? It's been recently shown because of an ACE2 receptor in our lungs. We have different cells, but an ACE2 receptor in the lungs are hyperactivated by nicotine. So the ACE2 receptor is also a good catcher for respiratory illnesses and viruses like COVID-19. So we open our airways to capture more respiratory illnesses like COVID-19. So COVID-19 and coronavirus has presented good opportunities and bad opportunities for health outcomes. So it's a great time to quit and use and not use tobacco products. And we're referring, as far as our health department, to 1-800-QUIT NOW and the services we offer at the health department. So the risk of transmitting respiratory infections are higher for smokers and people who use tobacco products because of the hand-to-mouth issue as well. As far as youth goes and the epidemic of youth use of tobacco products and vapes, so forth, a preliminary study done by Stanford University School found that vaping is linked, not caused, but linked to increased cases of COVID and those who use vape products. So youth who have ever used a vape product ever were 5 times more likely found to have been diagnosed with COVID, and 7 times more likely when they use multiple tobacco products. So getting to the meat of it, so how do we turn the curve? What is the public health response locally, state, and nationally to flatten the curve of this persistent epidemic and keep it low, and the youth vaping epidemic? So metaphorically speaking, we know we're waiting and testing on a COVID vaccine. Metaphorically speaking, we vaccinate our communities and our nation with a tobacco prevention and control vaccine. So this vaccine, as you see here, it is put out by the CDC. It is not made in the laboratory, but it is not made of chemicals, but it is made of best practices, evidence-based policies and systems, environmental changes that we can apply in our community. So local tobacco control programs like here at the Health Department, if we use this, we have a great chance at preventing and decreasing tobacco use within our community. So each ingredient, as you see there, you have robust funding, price increases, tobacco 21. I'll get into the meat of that shortly. Easy access, effective tobacco treatment, smoke-free, tobacco-free policies, and hard-hitting media campaigns. So tobacco 21, as many of you may know, the administration and the General Assembly at the federal level, they passed a tobacco 21 law. Okay, that is the law of the land now. You must be of age 21 to purchase tobacco products. This is a very important step, one great step for mankind, as people landed on the moon said, one great step for public health, because data shows us that 95% of people who smoke begin before the age of 21. So therefore, increasing the tobacco age to 21 can significantly reduce the number of adolescents and young adults who may not uptake on smoking, and immediately improve the health outcomes of young adults and youth. Our law books in North Carolina currently reflect 18. So if you go to a convenience store, you'll see 21, but tentatively, come January when we get a new General Assembly, they are going to be discussing what does tobacco 21 look like on our law books here in North Carolina. So that could mean better retail licensing, as far as you saw in the vaccine there, access to good cessation services and access to tobacco products as well via stores and so forth. Okay, so flavors, all right. Flavors have been around for a while. Cigarettes, they've been banned in regular cigarette products as well. So in January 2020, the FDA enforced flavored e-cigarettes, their jurisdiction and their policy to limit the amount of flavored products that can be on the market. So in January 2019, the FDA finally called the hand on tobacco companies and vape products selling these products because of the surge in youth tobacco use. However, they did leave a few flavors and exceptions in the rule as far as menthol and mint flavors. Okay. So locally, our Board of Health here in our Public Health Department, what have we been doing? We did pass a few resolutions that kind of got up to the chain. I believe eventually got up here to the top. That we are supporting our Board of Health and you all helping us pass more stringent and strict policies surrounding smoke-free and tobacco-free policies in the government buildings, municipalities, vehicles, indoor public spaces, and indoor venues and so forth. We also passed a vape shop ordinance as well, and I've got a map to show you here shortly. So we know that oftentimes we see different tobacco shops, vape shops popping up everywhere, and a lot of studies are going on how to figure out how does that influence the landscape of our community and tobacco use as well. So as you see here, and on our Board of Health, I can't remember her name, Jeanette, Dr. Council. She's not here today, but she was part of this, our Board of Health choosing vaping, youth vaping and smoking as one of our priorities as Board of Health. So we created these maps to kind of get a visualization. What could a zoning ordinance look like if we did incorporate that into our community? And as you see here, the black dots are tobacco vape shop retailers. And in the red dots you see, let me switch that up. The red dots are tobacco retailers. The black ones are schools. So relative to schools, what could that look like if we zoned away tobacco shops away from schools? This is a half mile, okay? You see a half mile radius of schools, you see tobacco retailers. So that is very important too, to kind of get those away from schools. And it's not a great trend, but there are some municipalities and governments across the nation looking into this even more so. So we did this in partnership with UNC, Fort Bragg, Public Health Department as well. So speaking of Dr. Jerome Adams, our Surgeon General from federal government, he came down pre-COVID on February 4th, and he came to speak of COVID and what that looks like, and even the opioid epidemic. But Ashley Curtis and our partners at Fort Bragg and UNC, they spoke of this. They created this poster presentation to relay the work that we are doing here in Cumberland County with our military community. This initiative is now known as the Military Health and Readiness Initiative. We did receive a little extra funding from the Tobacco Prevention and Control Branch to advance our work in working on cessation, availability, pricing, and smoke-free, tobacco-free policies in relative to the military. This is very important because we need to focus on the readiness of our active duty military, because they have been known to have higher rates and use of tobacco use. And I found this alarming and kind of interesting, and I want to work on it and make a change over these next several years, is that those who finally join the military, they initiate and uptake smoking after they enlist in the military. So we're going to be working there, and we appreciate your support in all these things. So as you see here, as mentioned, the Regional Tobacco Control Manager. What is the region? These are the counties that I cover with the funding from the CDC, aka Tobacco Prevention and Control Branch at North Carolina. This is to show us how we measure up to our Region 6 tobacco control counties. Obviously, we want to see more gold and purple than white. So gold, as you see, that's the gold standard, or excuse me, purple is the gold standard for tobacco-free policy. So I myself, I'm funded for 5 more years to working, and this is the guidebook of what my goal is, to provide technical assistance to not only our county, but at the surrounding counties to advance not only smoke-free, tobacco-free policies around government buildings and workplaces and all those things, but all things tobacco prevention and control. So this is kind of where you settle in, and how we can all work together is advance programs, policies, and environmental supports to prevent tobacco use in our community. So this is just a reminder where the general statute sits with not only our local Board of Health. We can adopt a rule as far as Board of Health and pass it up to you guys for your review and your approval to expand our smoke-free policy. As you may hear in the news, some of you may have heard New Hanover's moving forward with that. Ashley worked with Randolph County, and they did that kind of through the window of the Board of Health and working up to pass a policy. So kind of keep an eye out and ears out, so what that looks like going for them as well. So there's the reference to the general statutes as well. So non-smokers do have a right to breathe clean, easy air. So I got about 1 minute left. So yeah, let's just move here. I love this quote. I heard it early on in my career in public health. I've been in public health for 8 years. Change happens at the speed of trust. And we have to earn the trust of our community in many different ways to make change. We have to earn the trust of our family members. This can apply to anything. So I want to first and foremost thank all of you for your trust in our public health department to not only handle this pandemic, but the epidemic of tobacco use. And we just thank you for that. And I'll be glad to field any questions that you may have at this point in time. Who's first?
I see Commissioner Booth.
Mr. Booth, okay.
Okay, I got 3 or 4 quick ones.
Sure.
Is the smokeless actually as addicting, like physically, or is it more of like a comfort thing to get away from like smoke and squinting your eye and the smoke in it? You're still kind of smoking, but is it actually physically addicting, or is it just more of a comfort transition?
You're talking about the vape products?
Yes, sir.
When at public health, when we say smokeless product, that means like spit or chew. So the vape products, they can be as addicting or more addicting than regular cigarettes.
All right.
The short answer is it depends on the product and the level of nicotine in that liquid solution.
All right, the feds have their law, but they're not required the states to do it. Is this much like the Colorado pot law? they say you can't have pot in America, but Colorado said, yes, we can. They went, all right. I mean, is it something they're going to try to enforce, or, saying that you must obey federal law and then not enforcing it? What is that going to do?
You're referencing the Tobacco 21 law. So that is the law of the land. So
Okay.
that is the speed limit of every state, municipality, and forgive me if I didn't make that clear. So every state, there was no grace period in introducing it. It became effective the day it was signed. However, in North Carolina, their law books do not have that reflected, even though we still have to, retailers still have to sell it at the age of
So
21.
North Carolina formally through the legislature didn't pick up and copy the law.
Not yet.
Okay.
But they have to. There is a grace period and time period that they have to do that and show that they are implementing that in that
Okay.
enforcement. Yes,
And my
sir.
last one, Randolph County, how did they get 5 out of 6 purples? What are they doing? What are they doing so different? Just, like you said, that's the standard. They're
Yeah.
one away from the clean sweep.
Correct. Yeah, and that's, what are they doing? Ashley could probably speak even more to that, but Ashley was instrumental. Their health director was very instrumental in that as well. So it takes time, as I mentioned with my quote there, building trust within the community and understanding of our culture, what we think around tobacco use. And they had a good process with their Board of Health and their commissioners, they're reviewing it and getting a policy that works for them. I mean, Randolph Asheboro is a beautiful community. It's the heart of North Carolina. You got the zoo, so they did it in honor and probably protection of their citizens and all who visit there, millions of people every year. So you got anything to add to that, or? No?
Sure. I can speak on that a little bit. So one thing that they did was they worked with the zoo heavily. The zoo actually passed their tobacco-free policy first, and then they started working with the municipalities because they wanted support of the municipalities before they passed a rule at the county level, because the county level would only cover the unincorporated areas. So they wanted to make sure that they were able to cover everyone, and it really was a team effort. The Board of Health spoke with the commissioners, and they all passed it together at one time.
Okay, thank you.
Mr. Adams?
I just have to go, and maybe I'm just missing something, but on your 100% tobacco-free, smoke-free written regulations, on Cumberland County, you don't have government grounds, and I thought we had a regulation that you can't smoke on county property.
Yeah. And it could be, this is not the most up-to-date, that one that was shared with me, we constantly have to update it. As far as how that works is sometimes we track down the policies that are,
This policy been in effect since I've been, I
Yeah.
mean, I remember
Is that-
this, we had a big thing on
Yeah.
this, because we actually
Okay.
had a big issue as to whether we were gonna move it to the parks, remember?
Yeah.
As
Right.
to whether we were gonna do it at the park, so that, the grounds has been there for a long time, so I just wanna make sure the chart gets
We
updated so
will.
that, that is clear, but we have that with us.
yeah.
Oh, I think it may be that our policy only extends to
Right.
the unincorporated
Well, I
area,
mean, that's all we can do.
but
And to our county buildings.
to our county
I don't know about
buildings.
the municipality.
Not
No, wait a
all,
minute. But our grounds, the next one's the grounds.
but I think
all
they're
we
talking
can
about
regulate-
countywide.
Yeah,
But
well,
not just county government grounds.
Yeah, I think it's just county government grounds.
huh?
I think that is speaking to county-wide.
Yeah.
You're correct, Commissioner Adams, as to the county-owned property, but I don't know that any other municipality has such ordinance in place.
But
Right.
then I think the chart needs to be changed because it just gives a misunderstanding that we hadn't done anything in terms of our grounds in terms of that. So I think it needs to be having municipalities or something up there because, I mean.
We do have a municipality chart broken down per county. And I have been finding what I've been tasked to do, I've been here since March, and I'm going through these dashboards that are, that the State Tobacco Prevention and Control Branch have for us. And I'm going through each municipality, not only in Cumberland, but all these other ones, just to be sure, like, nothing went undetected and that they have the most accurate policy and send that on up to them. So as far as being somewhat of the new guy and with all these things going on, I am verifying and being sure that they have the most up-to-date policy. And we were reflecting to you all that what we're doing is great as well, right? But there's obviously still some room for improvement. Ashley,
So
yeah,
this form is actually tracked and sent through the
Yeah.
Tobacco Prevention and Control Branch
Yeah.
to the CDC. And what the CDC wants in those reporting is countywide that covers municipalities. So that's why you're seeing that we don't track, if it's only county-owned, we track fully through municipalities as well.
Okay, good point. Yep.
Okay, well,
Yeah.
I agree with Vice Chairman Adams on that. And I wish you would check into it and just
I will.
see, I mean, look at Moore and Randolph and see what their policy is versus ours,
Yeah.
okay? Because we thought we've done all we could. If we can do more, we want to know that.
Sure, we will.
Any other questions for Travis? Thank you for informative presentation. Dr. Green, you got anything to add? Ashley, you? All right, get back to work. No, I'm kidding. We've not let Dr. Green rest since she's got here. Ms. Cannon.
Mr. Chairman, item number 3 is the consent agenda.
Okay, is there anything to be pulled from the consent agenda? If not, do I hear a motion?
Motion to approve.
Second.
Moved and seconded. Any further discussion? All in favor?
Unanimous.
Next item, Ms. Cannon.
Yes, sir. We have one item of business, and that's consideration of adoption of the fiscal year 2021 Board of Commissioner regular meeting dates and the agenda session regular meeting dates. So just to highlight a couple of changes for the session in the coming year. As you know, the Martin Luther King Jr. holiday is on Monday, the 18th, which is a regular board meeting, so that would move it to Tuesday, the 19th. The Labor Day holiday is Monday, September the 6th, and so our meeting will be moved to Tuesday, September the 7th. We also have 3 dates that there may be a conflict with some conferences and the Legislative Goals Conference. And those are the January 14th agenda session, the August 12th agenda session, as well as the Veterans Holiday. And our recommendation is to consider moving those agenda sessions from that second Thursday to the second Tuesday. And so I'll be happy to answer any questions about the calendar.
Any questions? If not, do I hear a motion to approve the calendar?
Second.
Moved and seconded. Any discussion? All in favor?
Unanimous.
Okay, we don't have any nominations for this meeting, so we do have appointments. This time I call on Vice Chairman Glenn Adams for our appointments.
Thank you, Mr. Chairman. We have the Animal Services Board, but I think Mr. Booth.
Yes, I knew that, I think Shannon and Teresa were both very interested. I didn't know that Shannon had submitted her name. They are the co-owners of one of, if not the oldest, one of the oldest animal care centers in town. So I'd withdraw the name of Teresa Blackwell.
And with that withdrawal, Mr. Chairman, that leaves one nomination for the Animal Services Board, Jeffrey Brooks, and I would move to appoint Jeffrey Brooks to the Animal Services Board.
Okay, is there a second?
Second.
It's been moved and seconded. Any discussion? All in favor?
Unanimous.
Item number 7 is a closed session for a personnel matter pursuant to North Carolina General Statute 143, 318, 11A6.
Do I hear a motion?
Move to go into closed session pursuant to NCGS 143, 318, 11A6.
Second.
Moved and seconded. Is there any discussion? All in favor? Okay, the board now will go to
Unanimous.
closed session. Hold the handcuffs.
Motion to come out of closed session.
Is there a second?
Second.
Okay, motion come, any discussion, all in favor?
Unanimous.
Okay,
Motion to adjourn.
all in favor?
Unanimous.
Meeting adjourned.